thank you very much for taking the time to meet with us today to talk about your paper, Malaria Risk on the Amazon Frontier. And so the first question I have is just, would you mind sharing kind of your motivation for doing this project, and also just how your interest in kind of malaria research, and particularly these kind of socially vulnerable populations, started?
Well, first of all, thanks, Harry. And I appreciate the question because that's not a question that I get that often, and I think it's important. So that paper is a direct result of my PhD dissertation. And I did my PhD at Princeton, and when I got there, my advisor basically gave me freedom to do whatever I wanted. And I knew I wanted to work with health, that I knew. And I knew of those surveys that were done in the Amazon, and the PI was my former advisor in the master's program in Brazil. And he told me, if you want to work with those data sets, there are different rounds of data collection and we are stuck. Results don't make sense. We don't know what's going on. And I decided to take the challenge. I started working with the data. And it's so funny. I saw one day one map of the area. There was no connection with the data set. It was a map of the area, basically the forest and the design of the plots. And I said, what would happen if I map this? And I had no idea how to do GIS or anything. So I started exploring. I took courses at Princeton.
Yeah.
Oh, a lot. Yeah. And then I took courses on GIS, and then I took courses in the summer. That was the first time I learned about spatial methods, and I kept doing it. And I realized that the results didn't make sense before because we were missing a very important dimension of the analysis of the whole dynamic of malaria transmission, which was space. And basically, my entire dissertation showed the role of space in transmission. I also realized the role of time in transmission. And that work really allowed us to completely revisit this concept of malaria transmission in the Brazilian Amazon. So you really started, one, because I wanted to work with health, and two, because somebody challenged me to make sense of that data, and I took the challenge, and here I am. But that's how it started.
It's really interesting. Having taken your classes and kind of knowing that rising to challenges seems like a very natural thing. And it's actually, it very nicely flows into kind of the next question I have for you. Something that I really, really enjoyed about this paper is it's very unusual for papers in the public health and medical literature to give a lot of context about kind of the history of a given area, kind of the economic, and you go into a lot of detail about the economic history, some of the history of different so farming businesses, but also migrant farmers who are coming to this community, and then linking that, of course, to some of these transmission dynamics. And I was wondering if you could talk a little bit more about that, and so why it was so important for you for this paper to include that, and whether maybe we should be doing more of that in some of these papers.
Yeah, I think we should. And the reason is, in public health, context is everything. And one thing that I learned is, after working, all those years in the Amazon, I started working in Tanzania, and I thought I knew so much about malaria, and I realized I don't know anything because it's the same disease, but it's a different vector. It's a different context. I'm not in the Amazon anymore. I'm in the capital city of Tanzania. People are different, behaviors are different. So I had to learn a whole new deal to be able to even start working with malaria in Tanzania. So that initial description really brings back the importance of the social determinants of health, which is probably the most important conceptual framework we have in public health, that defines the context. And not just that, but allows us to bring what we call a human rights perspective to doing analysis in public health, which is bringing the space, bringing the individual characteristics and all of that. So describing the context was intentionally there. And it's really to point out that we're talking about one disease, but it's actually many different diseases depending on the context where we are. And in this context of frontier expansion in the Amazon, if you don't account for those things, you're going to do some kind of exercise, but it's not going to be a good study on malaria. It's probably not going to impact public health. And I'm glad you asked that, because unfortunately, we do have some studies like this that are completely detached from context. Sometimes they get published, but they're not going to advance knowledge and they're not going to advance policy. So we basically shouldn't be doing them. So I think we need more of that. So on the one hand, you raise awareness of why they are important. But on the other hand, you basically show you're doing the right thing, because all your results, they make sense in light of the context that you described. So yeah, we need more of that.
Yeah, I mean, I think that the sort of one size fits all approach, and you're describing your experience that even, like I think it is a natural conclusion. Maybe if you're working in a setting where you sort of get a certain type of perspective, that this is just going to apply everywhere, and the fact that you've seen in very different places it doesn't work is really, really informative and helpful to think about. And actually, I want to also kind of follow up on your point that sort of it's all about the context and the fact that you need to understand sort of drivers of malaria at different scales. And so in your paper, you talk about sort of the individual scale, the community scale, the sort of, and the state, national kind of political scales. And in reading your paper, in order to get measures, because in science we need measures, we need something to be able to latch onto that say that this is capturing that specific area, whatever it is, in this conceptual framework we have, and so you've pulled data from surveys, from ethnography studies, and from satellite data. I was curious because in the context of this class of geospatial analysis, like pulling together data sets is something that's becoming really, really important. I was wondering if you could share your perspectives just on what that process looked like, and how much effort did it take, and would you say that maybe in the course of your career, have you seen that maybe some parts of that process are maybe getting easier? Maybe sometimes people think things are easy, but they're not, and kind of just share some thoughts on that.
Yeah, so I think more than ever, and this is going to become even more common and more needed, we're going to have to link different data sets. So when I started doing that work, we basically had only the household surveys, 4 rounds of household surveys. But as I started mapping, then I realized that's probably not enough. So then I acquired satellite images, and when you're a student, you try to find everything, and I found this training at NASA. So I sent a letter and I got in, and I learned to do remote sensing at NASA. I did an internship there. And it made a heck of a difference, because I could create variables based on the satellite images that we didn't have in the survey. And I can get for every single unit in this particular area, including the ones I couldn't interview. And why would that matter? Well, what's happening in the neighborhood matters for me, but if I cannot interview my neighbor, then I cannot put that in the model. So If you only look at the survey, there's so much exposure you're going to leave out and that you're never going to be able to talk about. So that's an additional advantage of linking data sets, that you can strengthen your data by having information that you were not able to collect from the household survey. And then I brought other things. I knew that somebody had done a lot of ethnography in the area. And that may seem odd, how you're going to combine ethnography, with household surveys and satellite image. But that person was really an encyclopedia of the area. So not only I got all the data that he had gathered to ethnography, but I still have those tapes. I recorded hours of conversations that we had, and I had questions, and I showed the maps, I showed the results, and I told him, what do you make out of this? What's your understanding? So I recorded all of that, and then I also used that to inform. So for example, I could create, as if you're doing a multi-level model. So I could create other areas, aggregations, and I knew exactly what happened in that area that was different from another one because of the ethnography. So I created so many different variables that are probably not what people would imagine in the first place, but each one was important for me to put together this huge puzzle, which was to understand how malaria is being transmitted. Is it easy? No, it's not. I mean, first of all, you got to know what you're doing, because it's so easy to mess up when you're linking data that have different quality or different scales, and people forget that. And then who knows what kind of results you're going to get, because you're basically linking things that should not be linked. Is it hard work? Well, when you start working with huge volumes of data, nowadays, I mean, it's easy because you have those big surveys, you can use the Google credits and whatever, but still it takes you to navigate those things and be able to find them. And imagine running several, like a time series of satellite images. It gigs, terabytes, I don't know, it's something like big, it's big. So as long as you have the resources at hand and you can manage all of that, it's doable. But nobody should be merging different data sets if you don't know exactly what each data set is covering, the quality, the scales that they're using, because it's really easy to get excited and completely mess up and think you're doing a good thing. But so
I think that was a very very persuasive argument for how important it is to have a clear idea yourself of some kind. Even you have to propose it. It may or may not be right, but at least have some idea in your head of what each of these different data sources is bringing to your understanding of a given problem, and not sort of start running with the analysis full throttle until you have that really set. Because as you said, it's easy to maybe misinterpret things, or to really, I think it's the interpretation at the end that you get out of it, because if you haven't got those pieces aligned properly, you may not necessarily be able to make the right sense out of it. So I guess another thing that I think is an interesting approach that was taken in this paper was in sort of defining these geographies. You've mentioned this a few times in our conversation so far, where thinking about what the right spatial scale is to study this problem of transmission. And of course, like if you've got, this is again, this data problem, you could think about these individuals and these plots as being kind of the primary unit, or there might be something about the geography itself that is the relevant scale to, if you wanted to think about policies. And so in your paper, you applied a kind of local clustering method to define these areas using kind of a data-driven procedure. And I was wondering, if you could just share some thoughts on sort of these data-driven approaches to maybe define areas in the context of a public health problem, in this case, malaria transmission, versus what is often much easier, which is just relying on some administrative boundaries. So in the US, this would be like a census tract. In Brazil, there may be some sort of analogous unit.
Yeah, I think that's a really important question, because most often we are limited to data availability. So you don't even have the flexibility of saying, well, if my main goal is to inform policymaking from a policymaking perspective, that would be the best unit, because that's the unit the policymaker understands. And sometimes you just don't have that. You have data with a certain level of detail and you can't downscale it. So when you have very detailed data, it's easy to upscale and then you can aggregate to any level, but disaggregating, that's a completely different business. So that's one point. Sometimes you don't have the flexibility. When you do have the flexibility, when you have like we had individual level data, you can aggregate to any level. Then the question really becomes, first one, what is your goal? If my goal is just to show how things spread, regardless of policy or anything, then you can just use the plots and go for the plots, and that's fine. right? But if you really want to inform how things are happening on the ground and how control is deployed, how the system, the program that controls malaria is organized locally, then you have to do a little bit more work. And then, and that's where the engagement with the local people, the engagement with the local policymakers is important, because do they understand the different spatial units you are trying to use? So in that particular area, we used the clustering methods, but we knew that they had areas where they had vector control agents, where they deploy the intervention. So if they have teams working in certain areas, right? Why would you try to aggregate in different areas that for them, it doesn't make any sense? So we did a combination of that. We did a combination of, we use how far mosquitoes fly, because also if you're talking about a mosquito-borne disease and you are using some kind of level of scale that is completely nonsense based on how far mosquitoes fly, then how do you even interpret your results? We consider how they deploy their interventions, because then you can sit down with them with the map and say, well, who are the people that focus on this area, or the people that focus on this area, so they can better organize how they deploy the actions on the ground. Now, if like in Tanzania, the other work we did, then we use the same, we use a completely different units that we didn't have maps for. So what we had to do was to do participatory GIS, use the local knowledge, draw the maps, and then be able to, do the intervention, evaluate the intervention, and so on. So the very first question you have to ask is, what is my goal with this analysis? And then you are going to choose the scale that allows you to answer your question. And particularly if you're going to have a dialogue with people designing policies, people dealing with control, they should be able to understand that scale. Otherwise, they're going to look at you and say, very nice maps, nice choice of colors, but that doesn't help me at all. And you don't want to get that answer.
Yeah. Again, like going back to kind of what you were saying, the context is so important, and sort of the relationship. It sounds like also actually something that's coming out of this conversation is the relationships that you have with these different groups is very important. So in Tanzania, it probably took time to develop good relationships with community members who would then be, willing to spend time and say, oh, let me look at this map and let me try to understand and work with you. And that's not something that you can just kind of magically sort of create overnight. That takes a lot of time.
Yeah, it takes time for building trust. Being a good listener should be a mandatory skill in public health. Being a good listener, not coming up and say, I have all the solutions. So being a good listener, being humble, understanding what's going on, learning about the context, listening to people, and then that's how you build trust. It's not by, coming as if you know everything, but come as a person that wants to learn. And after you learn, then you're going to be able to help. That's critical. So it took time. But, that's why I think my first trip to the Amazon was 1999, and I continue going. I changed some locations, expand some locations, but it's always the same strategy. I don't think I have done any work that didn't involve the people locally from the government, and that's absolutely critical.
Yeah. I think for the policy perspective, it seems like a lot of these government does matter. So the extent that you can get them on board is important. I guess this is moving a little away now from malaria. So this is part of the goal of this class is to actually talk a little bit about cancer. And malaria is not cancer, and that's that. But I think a lot of the principles that we're talking about, I think, are very relevant for any kind of geographic or geospatial type of analysis, and how to think about your study design, thinking about the measures and how to collect the data, how to develop your conceptual framework. I'm curious though to hear your thoughts about what when you're in your experience, maybe you've happened to work. Well, actually, we've worked together, so you've for at least one cancer person. But like in some of the cancer epidemiologists you may have been working with, or folks that you know in kind of your circles who do cancer research, what are kind of the key things that you think that they can learn from some of this really detailed work on infectious disease transmission?
So, I mean, I think there's a lot, but maybe I can organize my thoughts in thinking of four things. I think the very first one is this exercise of thinking why space matters. That's the very first thing. And above all, what is space, right? Space is about the exposure. It's about access to services. So why space would matter for any studies in cancer epidemiology? That's the first thing. It's not about making the nice maps. It's not about using a method you think it's cool. It's, can you even answer that question? Whatever type of cancer you work with, can you answer this question? Why would space matter for that? And how you define space in the context of whatever type of cancer you work. That is the first thing. And again, when we deal with infectious diseases, we have to think about this. Because even for infectious diseases, the definitions of space can matter. Like if you're doing the vector-borne, well, how far the mosquito flies is an important thing. If you're doing a respiratory diseases, then depending on the scale, you have to consider how far the aerosols can fly. That's a whole different thing. If you're dealing with chemical contamination, then you're basically looking at the water level and all that kind of stuff. So even the definition of space connected to what you're doing is important. So that's the very first thing. The second thing is this idea that context matters. And again, if for infectious diseases, the context usually is the immediate context because things happen fast. For the cancer research, it's a bit more complex because here the context is the context where people are now. And again, that depends on how you define space, if you're talking about access. But it can also be the context of where people were, because cancer is a long-term thing. And that is related to the other definition of concept that I give you example, which is the exposure. So you have to bring context, but how you connect this context to the definition of space. So that's absolutely critical. So as you see, I told you two things we haven't even touched data yet. This is thinking.
Yeah, right.
So then after you've done this thinking, you know exactly why space would be important and what is it about the context, being context, whatever it is, you want to bring in. Here comes the third thing is, where am I going to get the data from? And here comes this idea of linking different data sets. Of bringing those different elements that are going to be absolutely critical to be able to characterize this context, whatever it will be. And you're going to have to link different data sets for sure. And then that brings me to the other one, which I think it's important for infectious diseases, it's important for cancer, it's important for so many things in public health, is the understanding that other disciplines are going to be important. So you're going to have to look at social sciences and see, as you link with those different data sets, what that can inform you. You're going to have to link with environmental science, and you've done that, the parks and all of that stuff, and how you bring into the analysis. So being able to understand all those concepts, those ideas, those theories, and bring this into your exercise that started from thinking what space is all the way to bringing different data and being able to characterize whatever process you're trying to characterize. So those things are important for infectious diseases. They are also important for cancer epidemiology. I think the caveat is that you're probably going to have to do this twice. One where people are, and if you have the data, going back a little bit to try to measure exposure, if the outcome that you want to see is the the infection or the mortality or things like this. But overall, the process, I think those four things are absolutely critical for ID, for cancer epidemiology. It's critical. Not doing those, You still can do some kind of spatial work, but I'm not quite sure if it's going to help you to understand, the main questions that you have in your research.
Yeah, that's really helpful. So space, why does space matter? How you're thinking about space, the context of that space. Do you have data? Do you have georeference data that can do this? And then what linkages do you have to do to make this work? Yeah. And kind of to some of the earlier conversations, some of that, the data part is probably a lot easier today than it was maybe back when you were starting these projects.
Oh, no question about. I mean, there's so many different efforts that just to start satellite images now. I mean, I had to buy my images.
Oh.
I mean, you can get so many things for free, and you have applications that have analyzed decades of information, and it's all ready, and you can download. We have, and a lot of this with support from NASA and from some of those institutions. You have places where you can download, for example, the combination of social economic information in space. So you can download all of those things. We have all those efforts of producing information at the pixel level, and even getting DHS, demographic health survey data, and putting at the pixel level. So there's so much available. And sometimes it's even overwhelming. When you go to somebody tells you, buy cereal. My goodness, you have an entire aisle with cereal. You have no idea what you want to buy. And so sometimes it can be overwhelming because there's so much information and you don't know. And you can be tempted of linking everything and it's going to be a mess. But so that's why doing that initial thinking is important, because you're going to have a list and then you can try to find the best things with the best scale. But the availability is really very large, and a lot of the stuff is available for free. So yeah, it's pretty good. And they're super fast servers and that kind of stuff that allows people to do this kind of work.
Yeah. I think in sort of my experience, I think that definitely the geographic feature side. So some of the sources, even that you're sort of talking about here, like the Landsat images, I think that those are pretty easy to get. I think the challenging parts are anything survey based will require some work. And then I think the other part of this that I think actually might be our. I have another question that actually isn't on the list that I will ask in a second. But the healthcare access piece, the health facilities, that might also be something that I think some people, if you're working in a country, as you said, if you have good relationships with the government, and you obviously have your IRBs and you have all your protocols in place that you're not going to misuse this. Usually, they're very willing to share that. But
yeah. It depends on the country, right, Harry? Because some countries have so much information, and that, like at the facility level or at some sort of geography level that is detailed enough, and you have records on hospitalizations, mortality, births, tons of stuff. Other countries have very limited. Or you still have stuff on paper and it's not really regularly entered. So we still have a large inequality in both what gets to be collected and the quality of that. So depending on the country you're working, you're gonna have very detailed information and everything else other than your health outcome. And then that becomes an issue because what's the good of having, let's say, satellite data at 1 meter and then you don't have health data and don't do anything. So that is still a challenge for some countries. But that's why for some countries we still rely on the demographic health survey, which is just a sample. It's every 3 years, so it's great, but it's not ideal. And then you have countries that have pretty much everything, and once you get an IRB approval, it's the limit is your creativity. You can do whatever you want. So we still have problems with that, but I think The challenge is the more you use and the more you show the potential of having those administrative records being analyzed, then the chances you can improve the quality of data.
Right.
So as you know, I'm from Brazil. I use a lot of data from Brazil. And sometimes I hear some of my colleagues in Brazil saying, oh, but the data are not good. I'm like, what are you talking about? It's great. It's great. But you got to use it and point to some of the challenges. But the signals you're going to get from that data, they're perfect. They're exactly what you need. And that's the only way to improve the quality is to use more. Right. But if you just complain, oh, they're dead, of course, nothing is going to happen.
Yeah.
Right? So.
Yeah, you got to have a glass half full kind of mindset, I think, to work in public health for sure.
Yeah. Well, I'm the kind that says the glass has water. So.
Yeah, right. Yeah, it doesn't even matter how much. Yeah.
Doesn't matter.
So actually, the question that I had that I think is really pertinent here is just sort of circling. We've talked a little bit about cancer. We've gone a little off, but going back to the paper, you ended with several policy prescriptions, which I think is also isn't as common sometimes in a lot of sort of medical public health literature. And yeah, just kind of sharing why was it important to have some policy recommendations here, and what sort of your perspectives on how and why people should think about including that in their studies.
Yeah, it's interesting you asked that. So I personally, everything I do has to have some sort of policy connection. And that's just me, right? I can't see myself writing a paper just because it's a cool topic and there's no policy implication, no implication for the community that is the subject of that paper. So I wanted to have an implication. I mean, when I was doing this, malaria was very high in Brazil. It's all this mess going on. And I felt like if I can give a contribution, that's going to be great. And there was an even longer and more detailed recommendation that was shared with the National Malaria Control Program. Till this day, I have connections with the National, I still work with them. And the great thing is in 2001, for the first time, Brazil decided to do targeted intervention. So before they were doing the same thing everywhere. And it's about 100 municipalities or so concentrated more than 70% of all malaria. So why what you do in those is going to be the same as in one that have just a handful of cases? It can't be, right? I mean, it's a country that doesn't have that many resources. So you should optimize the few resources you have. And there were ups and downs. I mean, they were targeting and then mess up again, and then they did the right thing. And so there were ups and downs, but the recognition of space and even starting to use GIS and heat maps and all of that in the program, now it became common. So I think I did because, you know, I can't see doing any kind of work that doesn't say something regarding that. And I think that there is a benefit because, again, if you go humble and willing to discuss and willing to help, not to impose anything, you can go a long way. And again, I started this in '99 and I'm still working with them. So I think it pays off.
That's awesome. Yeah. I think it's very interesting. I feel like a lot of times as students and postdocs, we're told a lot to like not overinterpret results or to focus so much on like, here are the million things that are biased and wrong with the study. And so at the point when you finish your, 3 paragraphs of limitations, to come in and say, oh, I don't know, to be like kind of very lukewarm, trying to say maybe, but here you just came full out, just said, here's what you got to do. I think it's really inspiring, it's earned. Like you've laid out the case for doing it, so it's not. You are acknowledging that whatever limitations are here, and it feels very earned. It doesn't feel like, you're saying something that's not. Yeah.
And I'm glad you mentioned that because look, I never saw a perfect data set. If that exists, send it to me because I've never seen it. So nothing is perfect. Nothing. Literally nothing. So there's always going to be uncertainty. There's always going to be limitations, right? Even when you design a policy, there is going to be uncertainty. There are so many factors that can go wrong, right? There's somebody implementing, the population have to want to do it. You may have difficulties in delivering what you have to. I mean, there's so many fabulous opportunities for things to go downhill, and sometimes they do, right? But you still have this idea of signals, right? The data are still showing enough that this is the way to go. You won't be perfect. There's going to be challenges, but this is the best you can do to improve the local conditions. So yes, go ahead, tell the limitation, but also make clear that guess what? There's nothing better than that.
Yeah.
So you better do it. And as the difficulties come, you go there and fix it, and you learn from them. So next time you're gonna, confront different problems, but not the same ones. And I think that's another lesson that I think everybody needs to learn. It seems obvious, but it's okay to make mistakes, right? I make mistakes every single day. I just try to make different mistakes, not the same. So, and that's totally fine. Totally fine.
Yeah. No, I think it's a good reminder, right, that you did the study, so you might as well be somewhat proud of it and not just hide behind all the sort of gaps. It's
Exactly.
very important advice. And actually this is kind of a nice segue to the next question. So I actually was very fortunate to be one of the students in your award-winning spatial methods class at HSPH that is consistently receives some of the highest scores in terms of student feedback. And you've been teaching it for how many years now?
Boy, let's see, 15?
15 years.
15,
wow.
Yeah, 15, I think. Yeah.
Wow. And so I'd be curious, kind of in reflecting on the experience, and also just this class is for people who have some orientation to basic GIS, but are really kind of early careers. So they're not super experienced in using these methods. And so what kind of advice would you give? Because a lot of, I think, the people who would be taking this course are people who are in this course will be giving some experience, some exposure to the basics of GIS. But yeah, what advice would you give to them? And maybe what types of skills do you think you're seeing being very important for people who are trying to develop kind of research expertise in this area?
Yeah, so one thing I would say is, so more and more, when you see like job postings and like research related in consultancy firms or government sectors or state health departments, things like this, there is a need for GIS. And we've had students in our department that got really well positioned because they had those skills. Why? Because it became normal, right? I mean, why would you make a table nowadays? People make maps, sometimes bad ones, but people make maps. Yeah. So it is an important skill to have. And anyone going through grad school nowadays, if you're lucky enough to be in a university that provides some training on that, you're really missing a terrific opportunity to learn those skills while in school, because once you get out of the school, it's pretty expensive to learn them. So it positions you better in the market when you're looking for a career. It also positions you to be a much better researcher because you have that additional dimension of the context. Again, think about the definition of doing public health with a human rights perspective. One of the items is space. It's collecting data with some level of space. Why? At the end of the day, you want to know who are the most vulnerable people and where they are. Mm-hmm. Right? So it makes you better as a researcher. It makes you better positioned to get a good job. And nowadays, anything in public health, if you don't have this spatial lens, you're not really doing public health. I mean, first, I think when I started my PhD, people didn't talk a lot about inequalities in this country. Okay, I come from Brazil. Inequality is Brazil's last name, right? So then I remember we had Hurricane Katrina. And that's when people realized, guess what? You really have to talk about inequalities in this country, because people affected were people that didn't have cars. The school buses were in the parking lot. They didn't have people that couldn't live in there. You could clearly see the neighborhoods. Most of it was right there with all the colors so people could see it. And now, I mean, with COVID, really, I mean, it's all over the place. Right. And then how are we going to address issues of inequality without the spatial dimension? You won't. It's going to be half of it. So to me, that should be a skill that anybody going through public health should be able to have some exposure, because if you're really going to engage in serious research in public health that has some kind of policy-making orientation with an angle on equity, you're going to need those skills. Otherwise, you're not going to be able to address those issues. I mean, of course, I'm biased because I like it. I teach it. I think it's important, but, you know, there you go.
Pretty hard to argue with what you've just said. So I think we can stand by that in this class, and certainly this class too. Thanks very much for that very strong plug for adding GIS and spatial analysis to your toolkit as a public health researcher. And so I think that that's kind of the main questions we had. So thank you very much, Dr. Marcia Castro, for taking the time today. Yeah, and I will certainly be in touch soon, but we really appreciate you taking the time to share some perspectives on this paper and your broader thoughts on spatial analysis.
Thank you, and thank you for allowing me to share some of my thoughts on this topic. So appreciate it.